You know Wegovy helps with weight loss. That part is clear. But what if it could also help you sleep better, breathe better, maybe even reduce the need for a CPAP machine? Let us talk about the connection between Wegovy and sleep apnea, what the science is starting to show, who might benefit most, and what to discuss with your doctor if you are dealing with both. First, what is sleep apnea? It is a condition where your airway repeatedly closes during sleep, causing you to wake up gasping or choking, sometimes hundreds of times a night. Most people do not even realize it is happening. The result? Poor sleep, daytime fatigue, memory problems, and over time, serious risks to your heart, brain, and metabolism. And the number one risk factor? Obesity. When extra fat accumulates around the neck, chest, or tongue, it physically narrows the airway. That is why weight loss is one of the most effective non-surgical treatments for obstructive sleep apnea. In a recent study, researchers looked at people with both obesity and moderate to severe sleep apnea. After about a year on Semaglutide, same ingredient as Wegovy, participants lost significant weight. But here is the kicker. Their apnea events per hour dropped too. In fact, one trial showed an average reduction of about 50% in apnea severity. That means fewer interruptions per night, deeper sleep, better oxygen flow, and more energy the next day. Now, Wegovy is not yet FDA-approved specifically for sleep apnea, but that may change. Novo Nordisk is running additional trials to evaluate its role as a dual-purpose therapy, especially for people who are overweight and also CPAP dependent. So, if you are someone using a CPAP machine right now or struggling with poor sleep, this might be a conversation worth having with your provider. The idea is not that Wegovy cures sleep apnea, but by reducing the fat around the airway and improving inflammation and metabolism, it might reduce how severe the episodes are. And in some cases, that could mean dropping to a lower CPAP setting, or eventually coming off it altogether. But it is not guaranteed. Some people lose weight and their apnea improves a little, but not enough to stop treatment. Others see a dramatic change within a few months. It really depends on your anatomy, your age, and how severe your apnea is to begin with. Here are a few signs that your sleep apnea might be improving on Wegovy. You wake up less often during the night. You feel more rested without increasing sleep hours. Your CPAP data shows lower pressure needs, you snore less, or your partner notices less gasping. Daytime brain fog starts to lift, and if you are not using a CPAP yet, but you are still waking up tired, with headaches, or falling asleep easily during the day, get tested. Even at-home sleep tests can reveal mild apnea that might be silently draining your energy. One viewer shared that after losing 40 pounds on Wegovy, her apnea index dropped by half, and her CPAP pressure was adjusted, down by her sleep doctor, not cured, but better, and that is the point. Even partial improvement means better quality of life. If this opened your eyes literally or figuratively like the video, it helps spread awareness about how weight meds can affect more than just the scale. And if you are managing both weight and apnea, comment below, are you seeing changes in your sleep since starting Wegovy? This wraps up our Wegovy series for now, but the journey is just getting started. Subscribe for new episodes where we tackle nutrition tips, mental health, and real patient stories. And let me know in the comments which video helped you the most.